So Children's Hospital Traunstein is an academic teaching hospital of Ludwig Maximilians University Munich and is a tertiary care pediatric hospital which serves the entire population in the area, from neonatal to adolescents, premature babies and intensive care. And we're located between Munich and Salzburg, on the foot of the mountains of the Alps and near the Chiemsee. We do somewhere in the magnitude of 200 to 300 transports per year. And it's normally divided into air and ground transports. So we have the possibility to send the helicopter, or sometimes referred to as rotor wing, or we can send the team by ground.
Transporting neonates or even preterm infants from one hospital to a specialized center implies many problems. These babies are sensitive and at a high risk for complications. To create a good environment for transporting these patients is a big challenge. The logistics are very important, and the key point is that we have to have good collaboration between the obstetric department and the neonatologists. And there have to be plans how it could be managed if a baby comes in problems and in trouble, and the structure should be defined. Another point is that you have to be available 7 days, 24 hours, and it should be a specialized neonatal transport team, and you should have a good equipment.
Our neonatal program is consistent of a neonatal transport team, and that team is comprised of a nurse and a physician. So we usually send a nurse-physician team out to pick up a neonate from either a sending facility, another hospital, or sometimes from the scene, because some neonates get born at home. There's been one study in pediatrics a couple of years ago where it's been shown that if you compare a specialty pediatric transport team versus a non-specialty team, a non-specialty team would be either a team of firefighters or paramedics that are not specialty in pediatrics, that the specialty pediatric teams had a much better outcome. And that was measured because they had much less unexpected events.
Usually we have an ambulance vehicle, and that is picking up the incubator and the team here in Traunstein, and the ambulance is transporting the team and the incubator to the hospital where the baby was born. In very urgent situations, we use the helicopter. The team is carried by helicopter to the hospital, and the incubator is being brought by the ambulance.
I think neonatal transport is definitely an evolving system. And I think many years ago we had less specialty teams available. We would send a physician or a paramedic out to the scene, and over the last years actually it's become clear that we need more and more specialized teams.
There is still a long way to avoid that babies suffer or even die from transport. With a modern high-end technology and a good infrastructure, we are well on the way to offering these little patients a safe transport setting.